Hey, thank you for coming back to the quick and dirty, the long video of all the chemo cancer drugs that we have. We're going to go list them all quick and dirty, okay? So interferon alpha, this is a medication that we give for what? It's going to be cancer and viral infection. This can also treat hepatitis, but also in the last video we talked about, since it does treat viral infections, I think the adverse effects, it's going to cause viral flu-like symptoms. Right, so interferon alpha, hepatitis, or viral infections may have flu-like symptoms. Tamoxifen treats breast cancer. Tamoxifen, Tammy's breast cancer. So this competes with estrogen, and it competes for binding sites to help breast cancer. May also have adverse effects that includes hot flashes, GI upset. Look for increases in calcium. It may cause endometrial cancer or pulmonary embolisms. The next medication is leuprolide or lupron. This medication is going to treat prostate cancer. And then you want to look for things that adverse effects with low testosterone. So it's going to be hot flashes, gynecomastia, bone loss, decreased libido, ED, erectile dysfunction. Of course, anything that has bone problems, you want to educate your patient to increase calcium and vitamin D and weight-bearing exercises. The next medication is going to be doxorubicin. This treats solid tumors, but the big adverse effect with this medication, of course, the bone marrow suppression. Know to monitor your CBC and know what your counts are. This causes red discoloration of urine, sweat, and tears. Every time I talk about this medication, what else causes urine or red discoloration, orange discolorations of your secretions? Rifampin, the TB drug, or pyridium, which is known as phenoazoparidine. When you hear about pyridium and you remember phenoazoparidine, azo is in the middle of it. Usually a lot of people remember azo as the over-the-counter pyridium. So look for the discoloration of the urine, sweat, and tears, and then monitor your CBC with that medication. Vincristine, or Oncovin, this treats a variety of tumors, but this stops cell division, but this one does not cause bone marrow suppression. But what you do want to look out is for peripheral neuropathy, phlebitis, GI upset. Of course, it causes alopecia, which is going to be your hair loss. Give antiemetics, and you also know the antiemetic, which is aldosterone. You give it proactively or prophylactically. And you try to use the central line with most of these cancer drugs. Cyclophosphamide or Cytoxin, it's going to treat a variety of tumors. This inhibits protein synthesis by interfering with DNA and RNA. But cyclophosphamide, I wanted you to remember, it has that serious adverse effect, which is going to be that hemorrhagic cystitis, inflammation of your bladder. You want to look for hematuria, signs of bleeding in your urine. Then you're going to see ondansetron again, Zofran. Common side effect is what? Headaches. The more concerning one is what? Widened QT intervals. And that might lead to a dysrhythmia, right? And then I want to go over that CBC again, complete blood count. You should know your ranges, know your ranges, know your ranges. So complete blood count, you're going to know your whites. Your whites should be between 5 and 10,000, 5 to 10,000. And also, if you want to remember the order of your whites with the CBC, with differential, never let monkeys eat bananas. Neutrophils are going to be your highest. Never let monkeys, neutrophils, lymphocytes, monocytes, eosinophils, and basophils. That's the order and how their prevalence and how high they occur in your CBC. So your H&H, your hemoglobin and hematocrit. Your hemoglobin, you should remember 12 to 18. Hematocrit, just remember that one number right in the middle of 45%. And then your platelets, I encourage you to remember 150,000 to 400,000. All right, so that's going to wrap it up for the cancer chemo drugs with the pharmacology review. I'm Nurse Nick. Like and follow. Stick around for more NCLEX info. Thank you, guys.